The diagnosis and treatment of dry eye is incredibly important in the current climate, considering the increase in cases due to screen time adjustments. Today, we're talking to Dr. Cam Silani with Beverly Hills Optometry about his advanced dry eye center and the different testing and treatment protocols he recommends. Dr. Silani?
I want to talk to you.
Not now, later.
No, now.
Today, we are being joined by Dr. Cam Silani of Beverly Hills Optometry. Good morning, Dr. Silani.
Pleasure to be here. Thanks for having me.
Dr. Silani, please tell everyone a little bit about your background and your specialty.
Absolutely. So second generation eye care professional. My family has been in the eyewear world for over 5 decades. I took over as chief clinical director at Beverly Hills Optometry, our advanced dry eye center, about 7 years ago. And we've integrated a lot of wonderful modern diagnostic and therapeutic equipment to offer our patients the highest level of care. We're in the heart of Beverly Hills, but we see a fair amount of patients locally as well as nationally, and some international patients as well. So we're very honored to take on some of these patients and some of these more advanced cases.
When we're talking about advanced cases, it sounds as though you may be doing something different as far as diagnosis and treatment. Can you walk us through your typical regimen when a patient comes in presenting symptoms?
Certainly. So all our patients come in when they're filling out their intake form. Every patient fills out a speed questionnaire and or a lifestyle questionnaire to kind of gauge the severity, duration, and frequency of their signs and symptoms of dry eye. Then we'll probe a little bit further and do a number of different tests. We like to integrate the Oculus Keratograph 5M, where we do non-invasive tear breakup time, meibography. We check the function of their meibomian glands. We'll do corneal and conjunctival staining, tear meniscus height or Schirmer's, conjunctival redness. We'll examine their lids to see if there's any telangiectasia. So we do a really thorough analysis of the anatomy and function of their ocular surface, essentially.
One of the things you touched on is a speed test. What is a speed test?
Yeah, so there are a number of different dry eye questionnaires, OSDI, DEQ5, and we tend to like the speed questionnaire because it's very easy and simple for the patient to fill out. It takes less than a minute, and it's very easy for the office to score, and we use that as a gauge, whether it's their first visit, their first dry eye consult, or they're coming back for follow-ups, pre and post-treatment. We're able to gauge how effective some of those treatments, whether their at-home regimen is being changed or we're doing any office-based treatments on them.
Let's talk about that for a second. So a patient comes in and you run a diagnostic test and you do a speed test and you discover that there's a problem. Do you have a standard course of action you utilize, or is it different for each patient? And if so, how do you decide the treatment plan?
So the diagnostic component is pretty standardized because we want to collect as much information as possible. It's very robust. Once we have the diagnostics in place, then we customize the treatment plan. That goes for their treatment plan in office, since we carry a lot of different types of equipment, the IPL, the lid hygiene, and different thermal devices, including things like Procara plugs, scleral lenses, as well as customizing their home care.
Are some treatments standard recommendations for all patients, and then maybe additional courses of therapy are added, or is each case completely different?
So we talk about 3 levels. One is lid hygiene, and in that category is things like BlephX and Zest. There's a newer player that's a microblepharal exfoliation device called AV Max. The AV Max and the BlephX are more of a automated device that use electric device that you use. The Zest is more of a mechanical, gentle approach to removing debris, build up biofilm on the lash line or the water line. So that's category 1. Category 2 would be your thermal technologies. In that category, you have your LipiFlow, your Tear Care, your iLux, MeiboFlow, and you have One Touch as well. And then in your third category, you have, we talked about the 3 levels. So level 1, level 2, and now level 3 is IPL or intense pulse light. So category 1, lid hygiene, helps remove debris, build up plaque, and biofilm. Demodex as well. Level 2 the thermal modalities help to unclog the glands, melting the poor meibum, and then evacuating the glands with a tear clearance device, a meibomian gland expressor, or in the case of LipiFlow, it uses an automated pulsing effect. And then IPL works really well for your inflammatory patients as well as MGD patients. By inflammatory, I mean things like ocular rosacea, telangiectasia, and things of that sort. And these three categories all work synergistically to complement each other. So one is not meant as a replacement for the other. Some patients require just level 1 therapy. Some require level 1 and 2. Others may require level 1, 2, and 3.
You mentioned eyelid hygiene as one of your steps. Can you elaborate a little bit more on what eyelid hygiene is and why it matters?
Of course, so oftentimes we use a dental analogy and the importance of brushing your teeth, flossing, and using mouthwash. So when we talk about lid hygiene, whether it's a deep cleaning exfoliation in the office or something to enhance the effects at home, we talk about the deep cleaning of the dentist, and then it's so important to go home and brush your teeth. One is not meant as a replacement for the other. They work, again, in tandem to complement each other. So if we're going to do a treatment like BluffX or Zest in the office, we also want the patient going home and using an OcuSoft wipe or foam or other lid hygiene spray, hypochlorous acid, in order to keep that biofilm, bacterial overgrowth, or Demodex to a minimum. If they can be compliant with their home care, it also enhances the effects of office treatments. If they're not as compliant with home care, we typically see them more frequently for office-based treatments.
Another one of your steps includes thermal treatments. Can you explain why heat matters in treating ocular surface disease?
Yeah, so the heat works really well. So the meibum within the meibomian glands can become stagnant. Stagnant from a lot of different components, whether it's they get clogged or stagnant because you're not blinking properly or the lids are not making contact. So when we're on screens, we tend to blink up to 50% less frequently. So it's important that action of blinking and the lids making contact helps to get the meibum moving. If the meibum isn't moving or it gets congested because of makeup, bacteria, inflammation, things of that sort, we need to use a heat device at a proper therapeutic temperature in order to get the meibum, which is maybe in a solid state, to a liquefied state, or to get that meibum melted and then evacuated or cleaned out.
All right, so here's an interesting question for our YouTube viewers. What in the world is meibum?
So your tear film is composed of 3 layers. Our understanding of dry eye is that majority of patients who have dry eye have what's called evaporative dry eye. Evaporative dry eye is derived from MGD. MGD stands for meibomian gland dysfunction. Meibomian glands are these little oil glands that are within your eyelids. That third layer, the oil layer, is the most important. So oil layer and meibum are kind of interchangeable. If your oil layer or meibum is poor, you're more prone to having evaporative dry eye or things like styes, chalazions, hordeolums, things of that sort. So we want to keep that meibum as healthy and unclogged as possible. And using these heat modalities, as well as keeping the bacterial and Demodex load to a minimum, is really important.
So if I'm a patient suffering from MGD or evaporative dry eye, are there specific symptoms I should look for?
Yeah, interesting. So that's a really great point. So some patients may have early signs of MGD or dry eye, and they may not have symptoms, just like a patient may have a cavity and they're not aware of that. The dentist or dental hygienist will pick up on it and they'll go ahead and recommend having treatment done. Other patients may have tooth pain, gum disease, things of that sort. So we talk about the same thing in eye care. Some patients may have changes to their meibomian glands. The anatomical structures might be shorter, which we call sometimes recession, or they might be missing, which we call dropout. If those glands are now causing symptoms, the symptoms that we tell patients to look out for are things like fluctuating vision, burning, itchiness, watery eyes. And watery eyes is a fun one because it sounds counterintuitive. If I have dry eye, why are my eyes watering? So the oil layer, if your tears are evaporating too quickly because the oil layer is not sufficient enough or is not consistent enough, the lacrimal gland, the water gland, tends to overcompensate. So when patients have MGD, it sounds counterintuitive, but your eyes may water so it's compensating by providing more water because there isn't enough oil there.
Okay, so a patient comes into your office where you run a diagnostics test, and then if a problem is detected, you perform an appropriate in-office therapy, and then send them home with a follow-up regimen. So that's it. That's the end of the process, dry eye cured.
Not quite. So as we share with patients, and I hope most colleagues are sharing with their patients, there's no cure for dry eye. We kind of relate it to an autoimmune condition. So we can treat and manage flare-ups, but we can't cure it. And the way we're treating and managing flare-ups and the condition is with these different office-based and at-home regimens. So not only is it important to target the root cause with that three-step approach that we talked about earlier of managing the MGD, secondly, important to take care of your home routine. In our home routine, we typically talk about 4 key pillars. One, if necessary, is a preservative-free, high-quality lubricating drop. Step 2, typically a little more viscous lipid layer, especially if they have MGD. Something like a Retain MGD or an Oasis or an Optase. Those are fantastic ones we recommend commonly. Secondly would be a warm compress or a heat mask. Specifically one warm, moist heat is really ideal. Step 3 is a really good lid hygiene, whether it's a wipe, a foam, or a spray. And step 4 would be a high quality omega-3 supplement or anti-inflammatory supplement, medical grade. Oftentimes patients will DIY it and do it themselves with a warm compress and use a hot towel. That really isn't effective because we don't know what temperature that's getting to. And more importantly, the heat is dissipating rather quickly. The true warm compress, it should be antibacterial, hypoallergenic, get the heat to a therapeutic temperature and keep it there for about 5 or 10 minutes. And a hot towel or a washcloth isn't really going to accomplish that. With omega-3s, not all drops or not all supplements are made the same. So it's important to go with what your eye care professional or eye doctor or dry specialist recommends. With lid hygiene, we want to make sure to pick cleaner products that may not have as many impurities and may cause maybe allergic issues with the eyes or may cause some other problems that we weren't hoping for.
Can you elaborate a little bit more on the importance of omega-3s in dry eye conditions?
Yeah, so omega-3 is really important. They have an anti-inflammatory effect, and some of them can actually support 1, 2, or all 3 layers of the tear film. Oftentimes, many of these are science-based. So we have patients who are put on these high-quality omega-3s, and it helps to support, again, 1, 2, or 3 layers of their tear film. It reduces inflammation, which is really important for our blepharitis patients or ocular rosacea patients. Blepharitis is one of those weird sounding words, but just breaking it down, blepharo means lids, itis means inflammation. So inflammation of the eyelids, similar to gingivitis. Gin meaning gums, itis meaning inflammation. So blepharitis is essentially just inflammation, is gingivitis of the eyelids.
How often do you see eyelid-related conditions like blepharitis causing dry eye issues?
Now, our practice is really unique because we're advanced dry eye center. So we see a fair amount of patients that are referred to us for dry eye from colleagues in the area, or they find us through various means, through Googling and reading our blogs or articles that we write on the topic, or some of the speaking engagements that we put on. But traditionally, the AOA put out a report that only 1 out of 3 eye doctors are checking patients' lids and lashes, having them at the slit lamp, close their eyes, and checking their lids and lashes. So we're typically trained to go right to the cornea, conjunctiva, and retina, check for cataracts and glaucoma and things of that sort. But so important, even at your routine eye exam, to ask your eye doctor to check the lids and lashes to see if there's anything unusual going on, any low-grade inflammation, even if you're not symptomatic. Our goal really, a lot of those patients who are not symptomatic but we're seeing signs, is to get them to a point where they're back to healthy and they never have any issues. If that condition goes unchecked, it's all about early detection and intervention. If that condition is not identified and diagnosed properly early on and addressed, those patients, it likely won't get better on its own, and those patients will inevitably have symptoms. And our goal at Beverly Hills Optometry is to hopefully kind of halt that step there.
As the chief clinical director, what is your role in working through these procedures?
Yeah, so oftentimes I'll be involved in the hands-on with the patient care. Other times I will verify whether the doctors are doing kind of auditing or making sure that the associates are identifying, diagnosing, and treating these patients properly. Some of these more advanced cases, if that general 3-step approach, in addition to the home care, is not enough, then I'll step in and make other recommendations, or they'll collaborate with me as far as, do you think we should do a Procara? Do you think we should do a Regenerize or biologic eye drop? Do you think we should do scleral lenses, and I'll come in and consult on those cases. Some patients may request me directly, and I'll be involved from beginning to end. Other times, my associates do a fantastic job, and they're able to take over the patients, and I'm there as kind of as backup. So it just is on a case-to-case basis.
One of the things you touched on a moment ago was the Beverly Hills Optometry blog and social media. Could you tell us a little bit about how your online presence has changed since COVID-19?
Yeah, so COVID brought some really interesting challenges to our practice, and because we weren't seeing routine eye exam patients for quite some time, our focus was to make sure to let our patients know that we're here for them, whether that's through video visits or telehealth conferences, telehealth visits, whether it was email campaigns letting them know we're here to reorder your contacts, we're here to hop on a video consult. If you have any eye emergencies or need urgent treatments, we can see you in office. Going through our safety protocols to assure patients that we can see them on time. So we were doing email campaigns, and we were also leveraging or utilizing social media to let patients know, one, to educate them. Our two goals really are to educate our patients and empower them. We want them to know that there are more solutions available to them today than ever before, and that's only evolving. We're just touching the tip of the iceberg as far as what we can do diagnostically and therapeutically with dry eye, and that's only going to improve as more research comes about, as more drops and therapeutics are being FDA approved. So we have some fantastic tools now, and it's only gonna get better. So from a practitioner standpoint, it's an exciting time, but also from a patient standpoint, it's where we are today versus where we were 10 years ago is we're light years ahead.
What do you think is going to be the next big topic in eye care? What are people really talking about?
Yeah, so one of the big things is that there's a huge unmet need in terms of identifying these dry eye patients and getting them the proper treatment. So oftentimes we'll have patients who come to us, have gone to 4 or 5 other clinics, whether it's optometry, ophthalmology, corporate, or retail eye care, or academic, say like a Kaiser, and they're told, here are some drops, we'll see you in a year. And that really doesn't resonate well with a lot of patients. And a lot of our patients are very tech savvy, and they do their fair research online, and they see that there are other technologies that are available, and they're a little disappointed that their previous eye care professional didn't make them aware of these other devices, these newer technologies, or modern technologies that are available. So that's where we kind of step in, and that's why we try to put out these different blog posts, articles. We were featured in Fox News and NBC News, and recently we were just on the Doctor's Show earlier this year in 2020. We did the filming pre-COVID, but it aired during COVID. This is a disclaimer. And that was really powerful because there are about 30 to 40 million patients that are diagnosed with dry eye just in the US. That number is easily 10x when you talk about international patients. And I still feel like there's a huge unmet need, and a lot of doctors that can really practice at the highest scope. So we're seeing a lot of these patients that will hop on a video visit from other city states, and they'll come and visit us. So it'd be really nice if colleagues can take care of those patients in their own area, because a lot of these patients need ongoing care, and it might be challenging for them to keep coming out and seeing us. And to your point earlier, is there a cure for dry eye? Do we just do this one and done? We'll see patients back for follow-up. So we'll oftentimes see them for their consult. If they are really insistent on being treated same day, we'll go ahead and treat them the same day. If we're really backed up, we'll schedule them to see them in the very near future for treatments. We'll set them up with their home care routine, and then we'll see them back for periodic follow-ups. Now, those follow-ups, if we're going to repeat any treatments or incorporate any additional treatments, really depends on how they're looking, how they're feeling, and how they're looking when we do their follow-up care.
Dr. Silani, thank you so much for taking time and joining us today.
I really appreciate it. And if patients want to find us on our website, it's bhiguide.com. And if they want to find us on Instagram, it's Beverly Hills Optometry Dry Eye.
Perfect. And we will link to both of those in the comments. So thank you very much, Dr. Silani.
Pleasure to be here. Thanks for having me.